How grateful are you to have come out of this, what one will call life-threatening experience? And what has been the impact on your mentality and psyche, Alibaba?
You see, the first thing is that being someone of an enlightened mind, you already have heard of people who have contracted this disease, that is a COVID virus, and had passed on. I've had friends that have passed on not too long ago. And then having been informed about all this stuff, and then it then happens to you. It's a different and total experience. It brings it home to you clearly. But you see, the fact that you then go to an isolation center and see how these doctors are battling with people who have these COVID issues, and you see them losing people by the breath of air. You see people fighting for oxygen just because it's a respiratory problem and they can't even get as well, because the bottom line of oxygen is 93% is the bottom line of oxygen. I was on 8 cylinders of oxygen. I mean, I was turning it around, 8 cylinders of oxygen. Wow. I'm not talking about somebody said something. I'm talking about a personal experience. So when you see those idiots, and I'm not even mixing words with them now, you can say broadcasting code, you can't be abusing anybody. Anyone that tells you there's no COVID is an idiot. Okay. And for the people that have lost anyone that is dear to them, if anyone is now telling you, yes, that's the oxygen mask. If anyone is telling you that there's nothing like COVID, I wish it upon their family.
Let's not go there, Alibaba. Let's not go there, yes, because somebody would say, you can't even wish this on your enemies. I know how you feel. I mean, you're telling us the impact.
Any enemy of this country, any enemy of this country, all those politicians that have stolen our money, all those people, all those enemies, I wish it upon them because I know what it feels like.
Okay, Alibaba.
I know what it feels like. And I'm telling you, I'm being very serious. And all those people that are telling people that there's no COVID and it is all propaganda, it's a hoax. I just need that. I was in room 4 and there was a turnover of people that were dying. Okay. People that were begging for nurses to give them air. People who were turning around oxygen, 20 bottles in 2 days.
Air that we take for granted.
That you cannot even just to exercise your lungs so that your lungs, that's somebody that is lying down and taking oxygen that you take for granted. And then one person will sit somewhere and say it is all being drummed up. It is because it has not happened to you.
Okay, Alibaba, I want to ask, because you used the expression, it brought it home to me. You know, and just to try and empathize a bit, I know you're not feeling like you have anything in common with these people, but let's try and identify with them a little bit. What do you think it will take for us to bring home that message to those who, without them having to experience it, communicate to them the reality of this pandemic?
I think what is necessary is information. And then for those people who have it, to continue to tell people. Let me tell you something. As soon as I made my story, made it public, people are sending me messages to say they had the same thing, but because of stigmatization. What is stigmatization? It is like having malaria, cough, cholera, or something. You just say it. It has happened to me. This is how bad it is. See, there are some people who don't make it because some of them did not believe that it was COVID. By the time they then realized, the man that was in room 5 was a pastor now. The man that was in room 5 that they carried out, at about 3 a.m., he was begging for air. Next door. So you can see how close to reality that is.
Yeah.
He was begging for air. And by the morning, when I now managed to sleep, and I woke up and asked, how is the Fisher guy? They said, he's gone, oh, bros.
Yeah,
then you still have people.
That's my next.
You still have people who.
That's my next question. You witnessed, Alibaba. One is feeling One can feel, your vibe. This is real. You witnessed people die. Give us a graphic illustration of what it is like, people dying around you, and you survived, you came out of that to tell your story?
Let me tell you, my gas mask, I'm going to keep it for the rest of my life. I'm going to keep it for the rest of my life. I had it on me, and thank God. See, these doctors are working with minimum protection. Minimum protection. And so I was there, and people were coming to beg for space. And meanwhile, I'm talking of VVIP. I'm talking of VVIP area. The Gbogbo side. You can see people that can't even walk, can't breathe, can't go use the bathroom, and they're defecating on their beds and spitting into buckets. And these doctors they're getting the lowest form of protection, and they're still coming, and nurses coming to administer medication, attending to people. To just put it clearly, the doctors that are working there, I won't do it.
Wow.
If you do, what I will tell you, and the doctors that are resigning, I will tell you, if I have a brother or a daughter or a wife or anything that works in that place, in the conditions that those doctors are working in, it's sacrificial. They are putting their lives on the line, and it should be appreciated. Everybody, and if you have any donation, take it to that place directly and give to those doctors. Those doctors that wake up every day in the face of the risk to take care of us, and the nurses. No, it's not. And see, when people say, "Oh no, be subtle with your words when you are talking to these people who do not believe," now God will punish them. Now God will punish anybody when he talks in no COVID.
I guess what you're really saying is that we need to drive a hard message. But I thank you for what you've done, acknowledging the work of the doctors there, the sacrificial work. But I want to catch on to something you mentioned, that you were in the VVIP area. What can we do about people at the grassroots who, this is the situation I imagine they're facing. They're living in conditions that they're already exposed by virtue of how they live. Even if they had the symptoms, what is their hope of surviving? Because where would they get the treatment? What would you say to those people in terms of saying, come forward and seek some kind of...
You see, this COVID thing is manageable. But you see, if you already have pre-existing conditions, for instance, people who are asthmatic, people who are diabetic, people who have hypertension, and anything that can aggravate your even catching the COVID, it becomes a problem. But let me tell you one other thing. One thing that is saving Nigerians that people have forgotten is that from when we were young, we have been vaccinated against malaria.
Yeah.
And the symptoms of malaria are close to the symptoms of COVID. But you see, the vaccination that we had, I don't know any of you who remembers, we used to have a medicine called Sunday tablet that was building our immunity against malaria back in the days. It is one of the reasons that the professors are saying is saving us. But you see, overseas, they never had malaria. And so they were not vaccinated against the consequences of malaria. So the immunity that we've built from when we were young is one thing that is keeping our numbers down. It is not any miraculous health system, because the chloroquine that we still take here is what they are now just discovering that they could use to treat this COVID matter. So we have been on the side of grace. But the thing is, our health system has been very bad. And this health system that is bad is one of the reasons that our numbers are growing. Then
behind this door is the Red Zone, the very front line of Taylor Memorial Hospital's COVID-19 battleground. Immediately, we find casualties, all of them positive with coronavirus in the thick of its second wave to hit Nigeria. We're brought into a room where a patient has summed up enough strength to sit up in his bed. He's an American pilot who was infected during a flight over the festive period.
I've been here, I guess, 3 or 4 days, and I don't know, sometimes I feel improvement, sometimes I don't. Well, I can hardly breathe, so my chest was full. Well, my symptoms started probably on the 24th or 25th of December, and I'm part of a flight crew, so the whole flight crew, the flight attendant got sick and she thought she had a cold, and so then the co-pilot got sick. He thought he had a cold. So the 26th, we got a little worse, so we went and got tested. And today's a good day. Today's a good day. Well, you know, I don't fear COVID, but it is a bad deal.
We've spoken to the gentleman, and though he is in high spirits, the gravity of the situation is undeniable. He has been at the facility for the past 3 to 4 days, and though he says today is a good day in terms of his symptoms, he has most certainly had more difficult ones. And though he is optimistic for the future, it is a very serious situation on the ground. We have, as I've just said, spoken to a patient, and we're hoping to speak to medical professionals to get their insight on their work at this very trying time.
So when we started in June, it was still new, and we managed our way through it, seeing patients and having success rate and all, and everything went down. The second wave has been like a chaos, because it started we had a peak in November, people coming in, no bed space. We've converted so many places that shouldn't have been converted to wards. So the situation right now, it's a bit alarming. We, the health workers who are working in here, can understand, but we need to relate to others that this is the situation on ground.
This facility is meant to hold 11 patients. At the time of our arrival, there were 14. And with a car with another COVID-positive patient arriving downstairs, there's no sign of this wave subsiding anytime soon.
First of all, it's very annoying going out there to hear people who say COVID-19 is a scam, hear people say it's not real, we don't have it. It's very, very annoying with what we are facing here. So what I have to tell to Lagosians, what I have to tell Nigerians is that COVID-19 is real, and the second wave of COVID-19 is much worse than the first wave.
Despite the growing number of COVID-19 infections in Nigeria, the number of recoveries has far outweighed the number of deaths. But one look at this patient struggling to breathe in intensive care is enough to sow a seed of skepticism in even the most devout believer. As the sound of painful coughs fill the corridor, one can't help but hear 3 words of warning ring out for those still doubting the danger of this virus.
With Nigeria in recent weeks recording its highest daily toll of over 1,000 cases, all isolation centers across the country had to reopen to deal with the second wave of the coronavirus pandemic. But this J-Dome Treatment and Isolation Center, which was commissioned in May 2020, has treated over 600 confirmed cases of COVID-19, with most of them moderate to critical. With the second wave of the pandemic currently ravaging the country, the number of patients has skyrocketed in the last 1 month.
In November, we had a total of 42 admissions and then 15 outpatients. However, in December, this December alone, we've had 149 admissions and then 109 outpatients.
The patients all have similar stories. Most of them started by treating malaria.
I've always been having malaria, and it's been protracted. And the doctor said it's malaria. I'll go in, out.
I came back from a trip. I had reflu, and I was tested negative before I took the flight. And all that I felt, I thought it was reflu here. That I was treating, I had malaria, I had all the symptoms, but I never thought of COVID.
I lost my sense of smell, fever, headache, general body weakness.
Fever now came, body pain, then shortness of breath. It was actually the shortness of breath that brought me out of the house.
I had a persistent cough and very hard one, and chesty. And I was producing some very thick brownish sputum. So, and I had treated malaria, treated typhoid according to laboratory report. It is not abetting.
And grateful to be alive, they are full of praises for the doctors and caregivers at this facility.
You can see the commitment of the staff. I never knew Nigerians could have this, the cleaners, everybody. In fact, I call everybody here medical doctor. I don't know who is who. And they work 24 hours attending to you, scrubbing the floor, doing this, so committed.
The people have been fantastic with the drug administrations. And I am free now. I am okay. My chest is clear, both the upper and lower respiratory tract.
Well, I had a little cough, breathing problems. My oxygen was low, very, very low. You know, but as God will have it, we came in here and all local and crew were just wonderful.
So there is hope if only we can. And you see them, you don't know who is Hausa, Igbo, Yoruba, Efik, or whatever. They're all here, attending to you. At your beck and call, you call them by 1 a.m., they're here, 2 a.m. You need to be here in the night. You see, when you come here, I think this thing is worse in the night. When you hear wailings, what people do here. People are the trunks of death, if you know what I mean.
I have underlying medical issues. I have a heart condition, I have BP, but God saved me. Thank God for all my friends.
Unfortunately, despite Nigeria having over 80,000 confirmed cases and over 1,000 deaths from the coronavirus, some people still think it's a hoax. These patients have a few words of advice.
First of all, talk to me. I never believed it. I never believed it. But now I see it real. My elder sister that used to laugh at me while I wash, sanitize and everything, she cried. She cried and cried because she was the one taking me to places. She now believes that there is COVID. There's COVID though.
Don't even tell me that it is killing. It is killing. It's out there. It is out there. And I'm sure if you test the Abuja population, 3/4 will test positive.
You might not know how it feels like until you experience it. So it's real, honestly. Because I don't even know what to say. I used to think, I know some people might think it's not the way, or it's not as much as they're saying it, but if you come here, you see everybody keeps coming daily. So it's real.
I see all the things that happen in Chile, in Argentina, South Americans, all those things. And each time I say, look, God, let this thing don't get to Nigeria. Because if it gets here, I never knew the thing was happening.
This thing is real. Don't wait until it happens to you. Because I don't know. I spoke to some guys here yesterday. They are here. And I called them. I said, you people, when you get out, go and tell your mates. They are the people that don't believe this thing, that it exists. Tell them it is real.
I never doubted it. And I don't think anybody should doubt it at all. It's not a make-up news. That is a conspiracy theory of the ignorance.
If I have my way, there should be a lockdown, partial. For now, let's start with it, because it appears people are not just adhering to whatever government is saying. And again, I would like to use this opportunity to appeal to the National Orientation Agency for them to do more. Go to markets, in fact, go to churches, go to markets, come on to the television stations, and then talk to Nigerians. Tell them about the inherent danger. COVID-19 infection is real. We shouldn't joke with it.
Scientists and researchers around the world are still studying the novel coronavirus, and with all that has been established, how people contract the virus is still unknown most of the time.
You know, these things, you can't really say. In fact, I can't. I've been careful, maintaining. At times, you might unawarely let your guard, and it will just strike.
We stay in Ibadan. We were here before for years, but our children are here. So they were supposed to come for Christmas. But when we now look at the situation in the country, and my husband has something to do this December, we decided to come and do the Christmas with the children. So one guy just came in one day with fever and sore throat. And that was it.
I can't figure it out because I don't go out. I never doubted it. But having been indoors, not going out, not going anywhere, that is where my enigma, how I got infected again, even in my